I think all my career, I've really tried to do thoughtful neurosurgery and just to make sure that the biggest thing for me is to make sure that I get the right diagnosis and then to do good surgery to try to treat that. My name is Patrick Connolly. I'm a neurosurgeon at Penn Medicine, and I work at Virtua Our Lady of Lourdes. We recognize that patients are coming to see a neurosurgeon oftentimes with some trepidation. They don't want to be sitting in a neurosurgeon's office. Most people don't. We try to put them at ease and say, look, we do this kind of work every day. There's a lot of patients that are like you that are having these problems. I'm a general neurosurgeon, and what that means is that we treat all things brain, spine, and peripheral nerve. My fellowship training is actually in movement disorder, so a thing called deep brain stimulation that we can treat Parkinson's disease with. But in my regular work, we do a lot of brain surgery and a lot of spine surgery, treating acute and not so acute disorders of the brain and spine. In my elective clinical practice in the office, we see patients with a lot of typically spinal disorders. I tend to see a lot of older folks in their 60s, 70s, 80s, and they have arthritis in the spine, and that's causing pretty debilitating symptoms. And so we have a lot of surgeries that can be helpful for that. The kind of diseases we take care of, they're really whole person diseases. It really affects the patient's entire life and the lives of their family around them. One patient came in, just couldn't walk. He's a very active young guy, 28 years old, was living his life, doing his 28-year-old stuff, and he just couldn't walk and his hands became really clumsy. And we discovered on working him up that he had a very large spinal cord tumor way up at the number 2 bone, compressing the spinal cord, and we were able to work on him together and remove the tumor, and he's doing great, and he's back to work just 3 or 4 months later, and he doesn't have any pain anymore. His hands and legs are working great, so he's just back to his normal self. When people say that their life is completely transformed because of the thing that we do, that's really rewarding.